Hi, Mr. Honey.
Can you hear me, Mr. Chairman?
How are you, Ed? I can hear you.
How you doing?
Doing well, doing well. How are you doing?
Hey, Mr. Huckleberry. Supervisor Valadez.
Okay, thank you.
Oh, absolutely.
Mr. Honey, we're going to go ahead and mute you if you don't mind until you're ready to speak. So, does that sound good?
Okay.
Thank you.
Good to see you.
Nice to see you too.
Dan, how are you? Good. That's fun.
It's good. Yeah, you guys are doing great.
All right, yourself? Accelerated
Oh, just, you know, start from the top view. Oh, we're actually going to use some of these tools, I think. Yeah, well, supposed to.
Okay. I'm trying to figure out. I saw a really cute baby notable sitting on the
I know you know.
Oh, yes.
We go really far back.
If you're calling in, could you please identify yourself so we can add you to the list? I see one person calling in so
Yes,
far.
hello, this is Supervisor Steve Christie calling in.
All right, thank you, Supervisor. And we just had another person call in. If you could please identify yourself, we'll add you to the list.
Joe Winfield.
Thank you very much. We just had another caller dial in. Call in. Can you please identify yourself, and we'll add you to the list. Go ahead.
Hello, can you hear me? This is Jesse Navarro.
Okay, thank you.
Good afternoon. This is Co-Chair Chuck Huckleberry, and I'd like to call the meeting Back to Business Task Force to order because we have so many people on video conference or on the phone. We'll dispense with basically calling the roll. What I would like to do is kind of give you an oversight of what we'd like to see accomplished today. For those of you on video conference or on the phone, we're going to mute you at this point in time, and then as we go around, we're going to ask everyone who will have the chance to speak or to provide any input that they'd like. For those in the audience, we're kind of spaced out with our physical distancing. We have most of our 300 chairs taped off so that we can get about 56 people in this room with providing physical distancing. This whole process started with our first case of COVID-19 on, I believe, March the 9th, and then has progressed to the state of where the governor issued his stay-at-home order on March the 30th. That order continues in place today, subject to possibly being lifted sometime in the future, perhaps the mid of May or perhaps the later part of May. At this point, we don't know, but I'm going to, in a minute, ask Dr. Garcia to give us where he thinks we are on the infection curve. But the task force was really called to purpose on April 22nd, and we began forming it. And again, it was a very rapid process to do that. We today have about 120 members of the community on the task force in various subgroups or subcommittees or sub-elements, all concentrating on a very specific task or series of tasks associated with a specialty that they may have. Between April the 30th and May the 8th, which is really only about 9 days, this Back to Business Task Force has held 9 separate task force meetings, most lasting over 2 hours. We've taken the recommendations that have come out of those task force subcommittees and formulated what we then transmitted on Saturday, which is a series of recommendations, temporary measures for phased reopening. I think we sent those to, I believe, all the task force members, and we also provided another document in there basically called how to go back about expanding the seating areas for restaurants where they're limited to indoor occupancy of 50%. The basic purpose of the task force is really to get the community and professional input on this whole process of reopening. Basically, one of our guiding principles has been public health recommendations, so that anything and everything that we do to reopen goes through a public health vetting process to make sure it conforms with things that can actually be done to minimize the spread of COVID-19. It includes a lot of the business community, a lot of what we call the regulated community. It includes jurisdictions. It includes the general public. It includes labor. It includes our medical professionals. So it is, in fact, something that we view as very valuable in helping us guide the best approach to reopening the community and reopening economic activity while maintaining the best possible public health benefits. We have a bunch of 4 maps over here on the side of the room, and electronically we can get those to all the committee members, and they're a progression of basically week to week to week as we've gone through this process beginning on March 1, knowing that our first case was March the 9th. And if you look at those maps, you can tell that there's a definite progression from infection to what we call hotspot locations where multiple infections occurred. Those are the ones that have been concentrated on by our public health agency to stop the infection spread and to ensure that clients, typically in skilled nursing facilities, aren't further exposed. And as you look at that progression, in the red dot, a bright red dot means a recent infection. A lighter dot means 2 weeks. Even a lighter dot means 3 weeks, and a blue dot means 4 weeks. And if you look at that progression, we progress from a lot of red dots to now a lot of blue dots. So that's my simplistic way of saying that we might be headed in the right direction. But to basically get that confirmed, I'd like to ask, before we go to the first subcommittee reports, I'd like to ask Dr. Garcia to give his professional opinion about where he thinks we are in the infection curve and recovery. Dr. Garcia.
Thank you, Mr. Huckleberry. Back in early March, actually at the end of February, as we started to hear what was going on in Asia, we were all anxious and apprehensive about what the potential implications were for Pima County. At that time, we were right about to have the very first, the beginning of the JUMP show, and that is when we stood up our virtual emergency operations command, really in response to the first case that was identified in Maricopa County. And we want to be proactive and really have a high degree of situational awareness. I can tell you from that we had a very successful JUMP show, absolutely no JUMP show related cases, but then subsequently at the end of February, at the beginning of March, we started to see cases that were popping up. And the first dozen or so were all travel-associated cases, and in each case there was a really strong epidemiologic linkage to travel to places where there was infection, to cruises, to a variety of things that we knew really put people at risk. But shortly thereafter, we started to see the number of community-acquired cases really start to jump, and when they jumped, they jumped really quickly. So fast forward to today, Pima County has about 1,602 cases, which is 14% of the cases in the state of Arizona. Unfortunately, we represent, we have 134 of the 542 deaths, or 25% of the deaths. That is mainly because, especially early on, our long-term care facilities, our assisted living facilities, and other congregate settings ended up being hit fairly hard. And we know that the congregate settings across the country is really where the mortality is happening. And in fact, when we drill down to the mortality in this county, I can tell you that even though these congregate settings represent less than 25% of the total cases, they represent more than half of the mortality, more than half of the deaths. So that's really important. One of the bright spots is that testing has improved importantly in the last 10 days, and we are now up to about 18,860 tests as of Saturday, representing roughly about 13% of the testing that is ongoing in the state. So when I look at the epidemiology curve for this county in comparison to the state and in comparison to the rest of the country, I actually think that we are probably flattening out and are starting to see some real improvements. We remain extremely, extremely cautious. We are still in the midst of a pandemic. We should not relax. We should be very aware that vulnerable populations continue to be vulnerable. That is older folks and folks who are medically frail. And we need to be very cognizant of that. I will turn it over back to you, Mr. Huckleberry.
Thank you, Dr. Garcia. Our co-chair, President Robbins, is on a call himself right now and was trying to join us about 2:30. So I've alerted our folks that when he does call in, we'll go right to him. So that's where President Robbins stands. And I'd like to, hear from him on the reopening and his plans for the university and education in particular, because that's a major component of our economic well-being within this community. So with that, I'd like to go to our first subcommittee report, and that the co-chairs on that were Dr. Terry Cullen. Dr. Cullen is our newest public health official and public health director. I think she's now on her 6th day, and we haven't scared her off yet, so we're pleased about that. And I know that we also had as a co-chair would be Nancy Johnson from the El Rio system. So if we can, let's hear from probably Dr. Cullen for a minute or two or less, and then goes directly to Nancy Johnson. Thank
Perfect. Thank you so much for welcoming us. If you have the paper book, if you're under tab 4, you can see where our minutes are from our last meeting, and there is a graph in there that talks about the criteria for beginning of phased reduction that we will be referring to. And Nancy, do you want to take it over then?
Yes, can you hear me?
Yes.
Okay, great. Yeah, so welcome, Terry. We're delighted to have Dr. Cullen join us in co-chairing the subcommittee about recovery. And, I think the main piece for our subcommittee is that it's a partnership between public health and the science of public health and the safety and all the data that you heard Dr. Garcia talking about, and then the reality of practicing medicine and delivering healthcare in our community, and how can we retool and begin this phased reduction to keep our community safe. So that's the purpose for this group, and we had our first meeting just last week and went through all the data that Dr. Garcia just went over. And then we also talked about the criteria. And the book that I think you referenced, Terry, probably has the criteria sheet in it. Criteria for beginning of phased reduction of COVID-19 physical distancing restrictions. Yes?
Yes. Yeah, we do have that.
Yes. Thank you. Yeah. So at our first committee meeting, we went through the criteria and really looked at all of our stakeholders who are part of that group, representing the hospitals, other health centers, ambulatory surgery members as well, kind of talked through whether we felt that criteria was spot on for where we needed to head. And we all really felt like that was the criteria, with one addition that we had a pretty robust discussion about, which was to add hospitalizations onto that. A little bit of discussion about whether we removed any of the other criteria, but I think what we wanted to add on was hospitalizations for another measurement. And the other piece of our discussion was that we want to be sure that guidance coming from the healthcare providers and the healthcare system in the community, coupled with the science of public health and ongoing recommendations coming out from the CDC, are communicated consistently to the community. So we're working right now on messaging one voice around a lot of things about your own safety, your own self-assessment, and continuing to keep the most vulnerable in our community safe. So we're anticipating finishing that up, I think, in a couple of days to get some feedback on. But what we wanted from other members who are present today was in looking at that criteria, if there were other measures from a health and safety point of view that you can think of, or if you had additional feedback for us. Because I know just as we think about all the aspects of healthcare, dental care, for example, a lot of things that provide more risk for the individual or the healthcare professional, we're going to see those phased in aspects of healthcare moving a bit slower than some of the other transitions in the community, I believe. And I'll stop there. As for feedback, I'll also ask Dr. Cullen if she wants to add on.
I want to just add a few other comments. The committee that has been pulled together represents many aspects of the community, so we did hear some other feedback. I just wanted people to be aware of it. One was that the alerts coming in from the HIE have been very positive and helpful, so we want to acknowledge the role that the Health Information Exchange is playing. There was a recognition that rural communities are different and that we need to be attentive to the rural communities. Also acknowledging that some of the rural communities, patients from those communities may be going up to Maricopa or a different county, so we want to be able to make sure we can track them and follow up appropriately. And then there were ongoing concerns about PPE that were shared with us, and I think everyone is aware of that. And so that is, as you see, included in one of the phase reduction criteria, so we are addressing that. Thank you.
Thank you, Dr. Cullen. And if you looked at this group, it's made up entirely of medical professionals. And so, again, we felt that was the first group to meet and the first group that we'll be taking our advice from with regard to further reopening and relaxation of standards. So it's important that they stay in place and continue their work in guiding us out of this pandemic. Next, I'd like to go to the Business and Employee Health and Wellness Group. It's chaired by co-chairs Amber Smith and Farhad Mogimi. So it is whether we want to go to Amber, you want to go first, or then we'll go to Farhad.
Go ahead, Amber, if you'd like to start. Sounds like she's, there you go.
So it was a very broad discussion. The county did a really good job of bringing in extremely diverse group of business representatives. And I think that's really important to highlight. Down into a few different concerns. One is going to be the safety of going back to the workplace. One is how do you communicate out to your patrons on what does that look like, and then what are those barriers to businesses to be able to do so as well. So we went through all of that, and right now we are now working on how do we move forward. Sorry about that. Is that better?
No problem. That's good.
Okay. So one of the concerns that rose to the top was childcare, access to that. Schools are still closed, yet we need to be able to get our workforce out there being able to perform job functions. We did talk a lot about what does that regulatory environment look like for being able to open, what do those employees need, and then, of course, same thing with employers. And it's that community safety part that really came out as well, to be able to create community security. When is it safe to come out? What does that look like? And so that's where we are, is really those 4 areas, and now moving forward to try to tackle each one collectively.
Thank you, Amber. Farhad?
Sure, I'd be happy to add a couple comments. So staff did a wonderful job of summarizing all the comments that were received from all the subcommittee members. So hopefully you all have an access to the summary. But there are a couple points that I want to touch on in addition to what Amber just mentioned. As you all know, obviously federal requirements are going to be something that we hope all the employers are following, and they're being consistent on those federal requirements. So the CARES Act and making sure all the employers are actually updating their personnel policies and making sure that they're complying with the federal requirements of the CARES Act. That's something that we hope that we can share with most of the employers. In addition to that, we talked about OSHA requirements, and OSHA is a really good resource that has a lot of information out there, both for employers as well as employees. They have training opportunities for employees, so I would highly recommend to make sure that all employees are going through that training opportunity, and that's, you know, one of the things that I think the employers would appreciate as well. And then the one comment that really was very consistent, and that I think you all agree, is to make sure that we have a unified voice and we're all working collectively as one region to make sure that any information we put out there is consistent, and hopefully everybody throughout the region has the correct information, and we're all consistent on the information we're providing to the employers as well as the employees. And then the last one that was more of a request than a recommendation, and I think hopefully at some point this committee will decide what we want to do with that. And that was hopefully utilizing potentially the county as the lead to procure PPEs and potentially be able to procure all the equipment that's needed and be able to identify an approach to be able to distribute that equipment to hopefully businesses and employers that are on the front line. We don't have anything else to add, but be happy to answer any questions that you might have from the subcommittee report and the discussion we had.
Thank you, Farhad. Yeah, I think we heard quite clearly consistent message, unified voice, PPE for all employers who need them, and training. And those are the things I think we'll be concentrating on, trying to make those support systems work. I had a call this morning with one of Senator McSally's staff and indicated that I put in our order on top of our other orders of 100,000 N95 masks and 500,000 surgical masks and 500,000 pairs of gloves. So we'll see if we can get part of what we call Operation Airbridge. So thank you.
Thank you.
Next, I'd like to go to co-chairs of our expediting government regulations. And this is really what kind of things does the local public health agency or the county in this respect have to pay attention to in issuing new guidelines or rules or regulations about reopening. And there are really 3 task forces involved in this. The first task force, bars and restaurants. The second was resorts, pools, spas. And the last was attractions and tourism. And it's in those 3 areas where we've come up with some very specific recommendations with regard to what we have called temporary measures or guidelines or best practices regarding phased reopening. So let me first go to Brent Durad, the co-chair of this particular committee. Brent? Whoop. Brent's got a bad mic, so we're going to wait till he gets a good one.
There we go.
Okay, good.
Let me thank first by thanking Pima County. Really appreciate the strong leadership that was demonstrated by creating this process to help businesses reopen in the safest manner possible in the coming weeks. Thanks as well to the many subcommittee members and business operators who provided the input and the feedback at our recent meetings. As Mr. Huckleberry identified, we had 3 subcommittees. Bars and restaurants was the first, resorts, pools, and gyms and spas, and then attractions. Bars and restaurants, they met on April 30th. Resorts, pools, spas, gyms on Monday, May 4th. Attractions met May 5th. And then at those meetings, it was basically we went through suggested best practices by county staff, and then input was solicited from the committee members and the public as well. The committee for that group, Expediting Government Regulation Committee, met Thursday, May 7th. The best practice summaries from those 3 subcommittees were presented, and then feedback from members of the 3 subcommittees and from the public was solicited. Not surprisingly, there was a little bit of confusion among business operators just regarding Pima County's ability to implement and enforce regulations. It was reiterated throughout the meetings that Pima County cannot require certain standards to be met that exceed those of the state. And so therefore, what we're putting forth are best practices to encourage facilities to reopen in the safest manner possible. Looking at bars and restaurants, there were 17 subcommittee and public recommendations, and those are posted on the county's website. Additionally, county staff went through and they're doing a public survey, and I believe 8,100 participants have taken part so far in that, taking a look at those 17 recommendations for bars and restaurants. The great majority of people rated each of the 17 as extremely important. So I think that we're definitely on the right track as we take a look at what's in place. The temporary guidance will be in place for the length of the pandemic and until all COVID-19 restrictions are lifted by the governor and the Pima County Health Department. And this also applies to event spaces and catered functions. And then again, the compliance with the standards will be validated during the regular operator inspections through Pima County. Taking a look at resorts, pools, and spas, many hotels and resorts in Pima County are part of global chains and brands that are requiring safety protocols that in many cases exceed the best practices listed on Pima County's Preventing the Spread of COVID-19 in Lodging Establishments. Many hotels, however, are independent in terms of either how they're owned or operated. And so sharing the 8 recommended guidelines that were created with these properties will certainly be extremely helpful. Additionally, because many of the hotels and resorts also have restaurants, bars, pools, spas, best practices in a lot of these other areas apply to them as well. A couple of areas with the state that we continue to take a look at as well is just when we can see the reopening of pools at hotels and resorts. One of the biggest things in terms of being able to get back to business is having those pools open at hotels and resorts. We think that a lot of staycations with Tucsonans and certainly people coming down from Phoenix will happen in a big way, but that will not happen until those swimming pools are reopened. The other thing, too, is just taking a look at maximum group sizes and dates associated with that as well. So we continue to take a look at, in some cases, hotels, resorts can host luncheons for 900 to 1,000 people. And we just want to see, just in terms of those guidelines, when it's going to be safe to be able to get back to bringing meetings in as well. When we take a look at pools, Governor Ducey closed all community pools, splash pads, spas on April 4th, and then Pima County has a checklist of 8 items that should be adhered to before reopening. And that checklist also is posted on Pima County's website. And then finally, with attractions, 21 best practices were created for 3 areas: returning employees, volunteers to the workplace, reopening facilities, and then outdoor event setup considerations. Very strong participation from the attractions. Many are nonprofit organizations that are in great need of assistance as we start to reopen from the pandemic and head into summer. Implementing all of the best practices will be challenging for some of these attractions just due to some of the budget considerations that they have as they try to keep their businesses open. For the exercise of developing these best practices, however, I feel the reopening recommendations and guidelines that were developed are outstanding, and not only for attractions, but in all 3 subcommittees. And with that, I'll leave my comments there.
Thank you, Brent. Do we, Kathleen Erickson? Kathleen, she's the co-chair. You're on somewhere.
Okay, thank you, Chuck. And thank you again for hosting this platform for everyone. I'll just add to Brent's summary, which he did a very great job on. There was an overall concern for employee and consumer confidence, and how would any one of these task force and different areas, restaurants, bars, resorts and fitness and attraction, gain that customer confidence back. And with their employees, they were concerned with their safety. So more specific guidelines were a very welcome addition from this task force and from the county. Those have been communicated quite comprehensively as of today through the county. The downtown DTP has done our small part in getting the word out to the downtown businesses as well. There was a lot of discussion, a fair amount of discussion on expansion of seating areas for restaurants and bars, and looking at some creative ways that we can reutilize space, such as sidewalks and parking spaces, public spaces as well, to expand the seating area for restaurants now that the social distancing has increased and the amount of occupancy in restaurants has decreased. Also, the discussion about the personal protective equipment and the county helping potentially to provide or to connect the businesses with the PPE, and the DTP stepping in to assist with that and connecting the businesses. I was also very impressed with the idea of putting window clings on businesses that have abided by all of these guidelines and recommendations, again, giving the customer some confidence that these businesses are safe to go into. Thank you.
Thank you, Kathleen. Appreciate the effort. We also formed a faith-based organizations group, and I don't know if we have Linda Leatherman on the line. Doesn't look like it. Let's see. Jan?
Mr. Huckleberry, if we can't find Linda, I'm going to pull that down for 1 second. The faith-based group did meet last week. We had about 10 individuals, and many of the same concerns. We're just looking at how we can not only get people back into places of worship as quickly as possible, but there are some additional concerns because many of our faith-based organizations are also providing community-wide facilities for addiction concerns and to addressing addictions in terms of community collaborative that way. We've been talking with them about, again, all the same basic practices, basic standards, to not only ensure that we're using our faith-based community to get the message out so that we can, as Kathleen and others have addressed, the need for increased confidence in the community, but making them aware of where we are related to the pandemic. And we've just continued to push with the faith-based organizations the same size standards, et cetera, related to community meetings, and we'll work with them about how they can address and use some of the tools with PPE, et cetera, all the same concerns that some of our other groups have had.
Thank you, Jan. What I'd like to go to next is our community outreach. And it had two co-chairs, Laura Shaw and Raul Aguirre, and their primary purpose is to make sure that we get the message out consistently. We're getting the message to the right people, and everyone understands it in any and all languages we have within this community. And to make it as simple as possible to convey the message, it's important to abide by certain restrictions during the pandemic. So I'll first turn it over to Laura since you're here, and then we'll go to Raul in a minute.
Great, thank you, Mr. Huckleberry. So as you mentioned, the goal and purpose of the subcommittee is really to relay information out to the public. And our committee is made up of about 19 members. The county, thank you very much, did a great job of pulling a very great cross-section of media partners into this committee. So we actually have representation from major traditional as well as Spanish language media. We have representation from TV, radio, newspaper, print magazines, et cetera. But we also cross-reference this committee with major community organizations and businesses. So we have the U of A represented, we have Visit Tucson, Sun Corridor, the Airport Authority, as well as major employers with TEP and Cox, et cetera. So I'd like to just talk about the strength of this committee, because we recognize that there will be some resources that we need to put into media, but also we want these media to be supportive of us on the earned media side. So I want to thank the county again. This committee is very, very strong, and we had our first meeting on Friday at 2 o'clock, so we're ready and rocking already. And I wanted to bring up 3 items of the initial discussion, and this really echoes much of what the other committees are talking about, which is how do we really get the messaging out there with the different direction from the other subcommittees to both business owners as well as just general Pima County citizens of all demographics? How do we really give clear and specific direction to business owners? And there was a lot of discussion about the nomenclature that is being used. Do we use the words guidelines or measures or best practices? There's a lot of confusion out there, and I started to go out to some places to frequent, my hair salon, for example, and the reaction is all over the board. So it just reminded me that everybody has a different opinion about how to respond to this crisis. So we want to provide support to the business owners to help their customers feel safe. Safety is a very important thing, and one of the ideas thrown around is, do we have some mark of approval, a checkpoint, some sort of a graphic that shows a customer going into a business that that business is really prepared and ready to accept them and they'll feel safe there. In terms of messaging to citizens across demographics, we want them to feel safe too. We want them to feel safe going out, to frequent businesses, to still practice social distancing, and to do all of this in a very positive manner. We've heard that over and over, that we want to make sure that people know Pima County is open for business. We also talked in our committee about delivery. You know, this is going to take repetition, it's going to take depth, it's going to take across all of media for a pretty extended period of time, or at least as long as it takes. We've got to reach all segments of the community, and we have to do it with speed and adaptability, and so we're working on ideas behind the scenes to do that. And then finally, our committee talked about resources, what this will take. There's a potential of using some funds from the federal relief funds going to Pima County. We're looking into ways to expand those resources and really making sure that we have the investment needed to get the messages out. So that's my report, Mr. Huckleberry.
Oh, thank you, Laura. Raul Aguirre. Raul, you want to chime in?
Thank you, Mr. Huckleberry. Yeah, I think that I agree with Laura that we have a real good committee, and I think the challenge is bringing all, as I hear the subcommittee's reports, you know, we really see that a lot of the message is going to have to do with a lot of what the other committees are doing. You know, when I hear Nancy Johnson speaking about healthcare and how they're taking care of everything, that's part of the safety net for citizens in general, and then the businesses in particular. I also happen to have been sitting on a committee for the Restaurant Council with Amber Smith and other people, and some of those concerns have been brought up. You know, how do we put the message out and make sure that it's not conflicting with anything, and really a strong message from the county that that speaks to following the science is very important, and I'm looking forward to crafting some of the message with some of the other people. We're very excited about that, and I think the Pima County Communications people, their presentation, Mark Evans presented some of the work being done by the staff, Jose Merino, and all these different people, and it's a really well put together, diverse, creative, and I think we're going to try to work with that and enhance some of that so we can be culturally relevant in a variety of ways and with different people and different customers and different demographics. So it's coming together in a very cohesive way, and we're doing, you know, just a lot of thinking on that.
Good, thank you, Raul, appreciate it. We do have, I believe, Co-Chair President Robbins on the phone or available, so let's go to him.
Hey, Chuck, sorry, I was having technical difficulties. You use the Cisco system. Can you hear me?
We got you.
Okay, I didn't know if I was muted or not. I've had 2 unforced errors already today and unmuting unforced errors. But thank you for including me. You know, I think we're all spending our lives on these Zoom calls. I've been going at it since 5:30 or 6 this morning, and I'll go till late tonight, just like all of you. But I appreciate Chuck. He tried to call me earlier, so I'm probably remiss, Chuck, in understanding what you wanted me to do for this call. But I just appreciate the opportunity to work with you and try to get you know, our community back active. We're going to try to do our part at the university. You know, we're planning on our students coming back. We just don't know how many of them will come back. We need them all to come back, but we know that all of them aren't going to be able to come back. And certainly high risk faculty members and staff, we're going to encourage not to come back to campus and use Zoom or whatever the Cisco system, telepresence, whatever you're using here to do their instruction. But students are very eager to get back to campus. And, you know, the data is, and there are many people on this call that know this data as well as I do, that if you're under 30, your risk of getting really, really sick from this virus is fairly low. Now, of course, you know, there's this new pediatric inflammatory syndrome that's very similar to Kawasaki's disease. It's an inflammatory disease. It affects young children's coronary arteries. So, you know, things can happen, and there will be no way for us to completely de-risk students, faculty members, staff, and even community members from getting this virus if we bring a lot of students back from all over the United States. We think the international students are going to have difficulty getting here for obvious reasons. But we're going to do our part, and I just look forward to working with all of you and working together, because that's the only way we're going to be able to be successful, is great coordination and cooperation of working together to get our community back in action.
Thank you, President Robbins. We're interested not only in bringing all the university students back, but the university is a big partner in the educational system within the region as well as the state. Very important from the perspective of the economy, given the large number of employees of the university. And finally, you know, we can capitalize on the expertise in your colleges of medicine and the rest that are actually involved in some of the more innovative technologies that are being advanced. So thank you very much. What I'd like to do now is basically hear some comments, and I'd like to go first to the elected officials. We have, I think, 3 in this room, and as soon as we get done with them, and we will then go to the elected officials on the telephone. So let's start with you, Chairman Valadez.
Mr. Chairman Huckleberry, you know, it's a pleasure for us to be here. You know, as many of you know, you've heard that this is something that we've been actively working on through the virtual emergency operations system since the end of January because of the Gem and Mineral Show. But this is something that I know that our board and every elected official, both here and that couldn't be here, are very, very concerned in terms of maintaining public, not only public health and safety, but the sense of confidence in terms of being able to go out. I want to thank all of the chairs, co-chairs, and committee members for being on the task force, because your work has become invaluable, particularly as we're looking for guidance as a board and as a county for how we communicate, how we adopt certain standards, again, to ensure public health and safety and confidence, as well as being able to communicate those messages out to our community. So I want to thank all of you, and certainly we're going to have some discussions after this meeting to look at what we're going to be doing as a board, both as a board together, but certainly as a community together. Thank you, Mr. Chairman.
Thank you. And I know we have the South Tucson Mayor, Bob Tessel. He is here with us. So, Bob.
Thank you very much. I just want to thank everybody, all the committee members, community members, co-chairs, chairs of all these committees, and of course, Pima County has been very instrumental in all the information that's been passing around on our daily mayor's meetings that we have. And I feel very confident, you know, that the county has basically provided all the information that we've needed at this point in time that we can try and convey to our staff members, first of all, and then in turn, they've been speaking with a lot of the restaurant owners and other people on the community to give them, keep them up with all the information that has been coming out. And I think basically it's taken the entire community, the entire county of people, all its residents, the cities that have been involved, and I think that it's pretty much very important to keep the communications open between all these different sectors of people out here. And I just want to ask you that we keep that communications going.
Thank you, Mayor Tessel. Thank you very much. We have Dustin Williams, the Superintendent of Schools. Dustin.
Thank you, Mr. Huckleberry. Thank you for everyone joining today's meeting. It's very important. I'd like to say I did go to the Market Street for lunch, and the buffet is gone, and so you also have to have a mask to get in there. So it's good practices already beginning, and that's really important that we all work together. I'd just like to kind of read a couple statements that I have directly from the schools. One is schools will be ending right around here towards the end of May, and school will begin faster than we know it. And so in order to build the confidence with the community, we want to act as swiftly as possible. And here are some areas that they would like to have everybody's attention to. One would be mitigation support, guidance with the mitigation strategies schools should be using, assisting in obtaining hand washing stations, PPE support, cleaning equipment and supplies. Number two is testing for all positions needed at all school levels, antibody tests or any other type of testing that may be available to ensure to the parents that all of the people on the campus are safe. And if there is a way to label that, like for the businesses as far as COVID safe or whatever the word might be, I really don't want to use that word, but some sort of safety standard. And last is contact tracing and support for the schools. Obviously, if somebody does get infected, to find out how they got infected, and then guidance to what do we do with the schools at that point. Those were the three big things that we met and kind of talked about. What do we need to get thinking about immediately? And we do have a small little opportunity here in the summer to get these schools prepared. And I would just really ask the county that time is going to go quicker than we really realize. So we're on board to figure out any pilot program or anything that we need to do to work together. Thank you.
Thank you, Superintendent Williams. Appreciate your comments. Let's go to the elected officials. I know I see two on the screen video. I know one is at least on a call-in user, and let's see if do we have Mayor Romero? Mayor Romero. Okay, let's go to Mayor Honey. I can see him, he's here. So Mayor Honey, appreciate your comments.
Can you hear me?
Yes, we can.
Okay, thank you very much. It's nice to see so many strong community leaders together, all working for the same end. Somebody made a comment, maybe we could all work together and we'd have the exact same idea when we got through. If you can accomplish that, I want to hire you as my campaign manager. But so many good things are happening here, and I was able to glean a couple things by comments from individuals. You know, I'm a very pro-business mayor, and talking about opening up restaurants to where people could eat on the sidewalks or under ramadas or in the parking lot to help those individuals keep their businesses strong, but also to create social distancing and everything for the people in our communities. I think there are so many great ideas here, and I'm very supportive of everything you do, and thank you for the opportunity to listen in today.
Thank you, Mary Honey. Do we have Mayor Murphy?
Mr. Huckleberry, I just received a text from Mayor Romero. She said she's on the phone.
Okay, do we know which one? I think call-in user 5 was Mayor Winfield. So let's try,
Either 7 or 9.
well, try one or the other. Try them both.
Hello?
Hello? Is this Mayor?
Hi, Chuck. This is Mayor Lucina Romero. How are you?
Oh, good. We guessed right as to what call-in user you were. Thank you.
No problem. I'm so sorry I couldn't unmute myself, so I needed your help. Thank you first and foremost for putting the Back to Business task force and this particular steering committee together. I absolutely believe in partnership, and especially in times of crisis, where we all need to be on the same page and really hand in hand move our community together. So I really appreciate you doing all this work for all of us. Hopefully we can stand together and move on the same steps for reopening our community. I just want to, as we have these discussions, I want to go back to the first presentation by the Road to Recovery Subcommittee. And I wanted to get a little bit more input or feedback in terms of the criteria based on the CDC criteria, and put together in a really awesome one-page criteria page for the phase reduction of COVID-19 by Pima County Public Health Department. Wanted to go back to that because I know that we haven't met most of the criteria to open up in phase 1, and wanted to kind of get us all to thinking about where we are in Pima County and how do we make sure that even though Governor Ducey is pushing to reopen many businesses, including barbers, hair salons, spa services, and nail salons, that we haven't met our own criteria from CDC and the Pima County Health Department. So I just wanted to kind of warn about that, and then see how we all deal with Governor Ducey maybe moving forward, and yet us not being able to meet the thresholds and the guidelines put forward by the CDC and the Pima County Health Department.
Thank you, Mayor Romero. I think what I will be addressing that a little bit when we get to what we call next steps. And I think I'd like to get through all the comments first before we talked about where we're going next. And I know we had at least Mayor Winfield on one of the callers, and I think it was 5. So Dustin, you want to try that one?
This is Mayor Winfield.
We can hear you.
Okay, thank you. I appreciate very much the opportunity to be and to serve on this steering committee, Back to Business. I want to assure everyone that the town of Oro Valley is all in and working together with the region to help our community, whether that's employer, employee, customer, to feel safe. Ultimately, that's what's going to make the difference. And the various subcommittees, I think, have laid out some excellent first steps, recommendations, and that the town of Oro Valley is on board and working with each of the communities in the county to help make this happen. Thank you.
Thank you, Mayor Winfield. Do we have Mayor Murphy? Okay, great. Mayor Murphy.
Yes, Mr. Huckleberry. Sorry, I had some technical difficulties. I just got back on again. No, I appreciate everybody's efforts working on this, and I think a collaborative effort, obviously, this much similar communication is important, and I really appreciate what you put together from the ground up with the business community, hearing from the restaurant community on what they need to do to help with confidence in getting people back.
Okay, thank you, Mayor Murphy. Now what I'd like to do is open it up to the members who are in the room and who haven't spoken already, and I see Kent Blumenfield first, and then Trish will go to you next.
Administrator Huckleberry, thank you so much for the opportunity to serve Pima County in this way and being on the task force. I also serve as current chair of the Pima County Small Business Commission, and the initiatives that you began and our board of supervisors has been exemplary, and it shows true leadership, and I'm grateful for it. There is one anecdote which occurred to me in this discussion, and I'm particularly sensitive to Mayor Romero's comments about the phased criteria and whether or not the county has met them, and yet we are opening some things by governor's orders. Well, one of the things that may help going forward to all businesses across the spectrum, whether it be resorts, spas, fitness centers, restaurants, bars, what have you, is that an understanding that for all the wonderful effort and brain power put into this initiative, it doesn't necessarily mean that every great or best idea has yet come forward. And there are those within this community that will put in writing for their workforce and for their patrons various guidelines, and not just guidelines, but practices that they will implement. And I was thinking that it would be helpful, without prejudice towards any, and not necessarily a vetted process, but those businesses that would be willing to provide to the county because they think they have done an excellent job in the best they can do for their setting, to share it, where the county could then present those, perhaps by category, however they'd want to do it, as models for other businesses of the same nature to share and to look at and find perhaps a gem or two that would not only help keep their employees, their patrons safe, but also instill that sense of confidence to bring people back, which is, we all acknowledge, is a major concern. And so again, just an idea. Of course, it takes some staffing on your part, and I want to just comment on that. I'm glad to know that I'm not the only one up on weekends and evenings working. Misery loves company, and when I receive emails from yourself or your staff and other employees, everyone has put in a yeoman's effort, and I'm proud to be a resident of this county, and I appreciate all the work that you and our Board of Supervisors has done. So
Thank you, Mr. Blumenthal. We will certainly take that under advisement, and one of your suggestions about the barcode on the badge is an excellent one, which we'll be implementing.
Thank you.
Trish, do you want to, since we're broadcasting this, do you want to come up and use this mic right here in front? Or if you, sure. Or we can give you, there you go.
Okay.
We can just give you one and you can stay there.
That's fine. Thanks. Appreciate it.
Whatever you're comfortable with.
Yeah, that works. I'm gonna just sit down so I can hold this and not drop it. Okay, can you hear me okay? Great. Okay, thank you. I do, thank you for including labor, first and foremost. I know we had a little rough go there, but we're happy to be part of the conversation, albeit at this stage of the game. Listening to everything today, I do want to point out, much like Mayor Romero, Dr. Garcia said at the offset that we are still in the midst of a pandemic, that threat has not removed itself, right? I'm not sure which phase we're in exactly. I couldn't get quite clarity on that with the reopening phases from the White House. But we have some real concerns about worker safety. While we have the messaging that we heard earlier about Pima County is open for business and that it's safe, and we want the community to know that. In reality, we're all sitting in a room wearing masks, very far apart from one another. And we do want people to get back to work. It is important that we have a good, strong economy. I think we all agree on that. We definitely want to move past this. It's just the worker protections. And I really appreciate all the work that everyone's put into having, making recommendations for best practices, for guidelines. The main thing about those guidelines is that they actually be implemented. And so that'll be my hope as we kind of move forward in this process, that we see that good implementation, that we see employers being responsible, and making sure that their employees are coming to work well, and have the protections they need to stay that way. So that's a lot of my concerns. I'm going to read through. There's a lot of material here for me to catch up on, and kind of have a better understanding of all of what processes are being put in place. But that is our main concern, is worker protections, safe work environments, and then safe opportunities for the community to come in and be in those spaces and utilize all these services as well. But thank you for the opportunity to be here and participate. Appreciate that.
Thank you, Trish. One of the things that I heard very, very often in the discussion, particularly in our business and employee health and wellness group, was employers concerned over the health of their employees. And that was time and time again. And time again, they called out the need for personal protective equipment. And that's why we've gone to extra lengths to try and procure that for all the employers to give to their employees so they feel safe at coming to work. So
great.
Big emphasis on our part. So thank you for your participation.
Yeah.
Appreciate it.
Thank you. And if I may ask one more thing, we talked about people who have health conditions, who are most at risk, underlying health conditions. Is there anything in place or protections for those people who say their place of employment reopens and they should come back to work, but in reality, because of those underlying health conditions or their age or circumstances, they should not? Is there, it's a fine line where somebody has to decide, do I give up my job? Do I become unemployed to protect my health, my life? So I don't know if that's been looked at through all of these committees, but it's something that I would really encourage them. And for employers, that we can all make choices about how we operate as employers, to look out for those folks who've worked for you for a long time and may have those conditions. So, thank you.
Thank you. And some of those issues are addressed in some of the federal legislation, of which we're going to be exploring in much greater detail to see if we can ensure that those are most vulnerable are protected. What I want to do is go back to co-chair Dr. Robbins, because I know it sounded like he had to get on another call here in a little bit. So, Dr. Robbins, if we can go back to you for a few minutes or a few of your comments and where you think we're going and what we should be doing.
Well, I've been listening to all the comments, and I think it's, you know, there are many unresolved issues for sure. And I think we're going to be in this current state, in this new normal, for however long it's going to last, probably until we get a vaccine. But remember, the fastest any vaccine has ever been developed, I think, Dr. Garcia can correct me, but it's probably 3 or 4 years. I do think, though, I'm optimistic that particularly the Oxford group who was working on a vaccine for MERS, which is also a coronavirus, they already had the vehicle ready, and they're now into phase 3 clinical trials. But once they prove that's a safe method of inoculation, we still got to manufacture, we've got to distribute, and then we've got to administer at least 300 million doses in this country, but maybe 600 million if you need a second booster type shot, and 7 billion doses worldwide. So we need to figure out how we're going to have a slow re-entry and get things going. We would be happy, Chuck, to share our task force white paper on what we're going to be doing at the university. It's going to be test, trace, and treat. And I don't mean treat with hydroxychloroquine. We're going to treat by isolation and holistically treating anyone that tests positive or gets sick in our 60,000 little group of people at the university. And we've got guidelines, and we're trying to work to ascertain how many students are going to be coming back. Our faculty and staff are still at work, even though we have a furlough program. We've tried to preserve every job we can, and we're hoping that if more students come back, then we're modeling and projecting that we can reduce that furlough time and impact to our employees. But I agree with a lot of the comments that were stated earlier. We've all gotten pretty good at this remote working and social distancing, and that still has to be a primary objective of society because it works. I think wearing face masks, social distancing, washing your hands, all of the things that we keep hearing about are really, really important, so that we don't end up like New York City with all of our hospitals full of patients in ICUs on ventilators and people dying right and left. So I think a measured, thoughtful reentry is something we should consider, and that's why we're all here together. And Chuck, I can stay until, I was supposed to get on a 3 o'clock call, but I'll stay till the end of this call.
Okay, great. It would be great if you could share that white paper with us, because it would apply to probably a lot of us who have a lot of employees reporting it, into locations. So that would be very helpful if we could obtain a copy and, look at it as one of the best practices to do for larger employers. So thank you. Okay, let's go back to, again, anyone who's out there on the system. I think you can raise your hand or indicate you'd like to say something. Please go ahead. Fletcher?
Good afternoon. Can everyone hear me?
Sure can, Fletcher.
Thank you. Rio Nuevo's lifeblood, for the most part, is our restaurant industries. which were allowed to open today by gubernatorial order. However, many of them have chosen not to. To Mayor Romero's point, we're very confused. Those that want to open feel very ill-prepared to do that. I think your guidelines will help, but they need more than that. They probably need some significant training, which maybe, you know, Kathleen or Brent can talk about. And I think also some comments from our elected leaders as to the point the small business people made and the mayor made. We're nowhere close to our own guidelines. However, we're opening our businesses. Retail is open, barbershops and salons are open, restaurants are open. So are we collectively ignoring our own guidelines? It speaks, Chuck, to, you know, what are our next steps? And if that's the case, as a region, we're not going to buck the governor. We need to communicate that. And then I think offer whatever assistance we can to our merchants for them to be as safe as they possibly can in a time when, as President Robbins suggested, none of us are really ready for this. Testing continues to come up as a major issue, particularly with restaurant employees. I think it would be wise that every single restaurant server be tested, that every single restaurant employee be tested, so you can eliminate those that are positive. And I think, you know, we just need some guidance, frankly, I think, in terms of, are we really opening, which it sounds like we are, and two, what help can we give them to work through this period where it's not clear as to how we reopen.
Thank you, Fletcher. Let me, and I can, when I go into next steps, I'll talk a little bit about that. And so let's let everyone comment first. Do we have more comments?
All right, this is David Adami.
Yes, David, go ahead.
Thank you. I just want to let everybody know that if there's still anybody out there in the small business world that is having difficulty getting access to the PPP loans, Chicanos por la Causa has been approved as a lender. We've been working in Pima County. I think we're over 30 businesses now have lent close to $600,000 plus to businesses that weren't able to get into round one. So just want to make sure that was aware, and also, you know, put on the table that we also operate apartment complexes, charter high schools, and workforce, that those are things that we're going to have to think about going forward, and how do we continue to, you know, support that. There's, you know, unemployment, you know, I don't need to tell anybody about that, but we just want to make sure that some of those issues are still on the table. And in my final comment, just give kudos to Dr. Robbins. Great job on the Today Show. Thanks.
Thank you, David. Chancellor Lambert? Okay, try it.
Can you hear me?
Yes,
Chuck,
we can.
Can you hear me?
Yes, go ahead, Lee.
Okay, excellent. Thank you so much. Sorry I was a little delayed in coming on. So first of all, I just want to thank President Robbins. Him and his team have been working with us at Pima, and we're following a similar approach of testing, tracing, and treating. We have developed our own recovery reentry plan, but I just want to highlight one aspect of it, and it goes to some things that other folks have said. That is, we are really concerned about, you know, the health and wellness of our employees, and we want to make sure that, especially our vulnerable population of employees, who, and so we're going to try to figure out how we use the technology tools to incorporate them into the classroom, even if they can't physically be in the classroom when the students are in the classroom. And so that's going to be one of the key components of our plan. But also, as President Robbins noted, you know, the work with the students and a large employer is just adds a different complexity into the mix in terms of our lab programs and our career technical education programs. But we're going to figure this out, and we're willing to work with anybody else as well.
Okay, thank you, Chancellor Lampert. Appreciate it. Anyone else? I get the signal there's no one else not raising their hands. Okay, let me briefly talk about next steps, because I think that's what Fletcher was interested in. We will be going to the board sometime either Wednesday or Thursday in emergency session to adopt a proclamation that puts in place as a series of temporary control measures associated with the COVID-19 outbreak. All of those 17 measures that you saw under restaurants, as well as those measures dealing with the balance of the subcommittees. That document then will be an enforceable document during the pandemic outbreak, and we should have that in place by probably no later than Thursday. We are just now drafting the ordinance and proclamation that will go with the measure. What we will try and do is get it finished by probably no later than noon tomorrow, and shoot it out to everyone so you have at least an idea of what it says and what it encompasses as we then adopt it by the board, which will then be our temporary enforceable regulations. And so it will have an enforceable capability. There are things in that 17 documents and the others where it's obviously not enforceable, where it says if you can, use cashless or touchless transactions, if appropriate or if available, that's obviously not enforceable. But social distancing is enforceable, occupation limits are enforceable, and so other items are. It will be up to the board in whether they consider that an appropriate measure to adopt and put into the county code on a temporary measure. In addition, and there is obviously some debate in the community about where we are and whether it's too soon or too late, and that's probably a good debate to have, but it is at this point academic, at least on the restaurant side. And so our view is that we need to get those best measures and best practices and regulations out as quickly as possible, educate the industry as quickly as possible, and provide as much support as we can to them. So we will be doing that in the next day or two. This task force, in our view, stays in place. The subcommittees stay in place. They're subject to call, which means that if conditions change or there's any substantial change in any of the conditions in the next week or 10 days, we can call this group back to business, so to speak. So we know that you will have a continuing role. And if we continue to work our way out of this pandemic by decreasing cases and decreasing hospitalizations, which is going to probably be a fairly important measure that we add to our list of measures, as was discussed by our Committee on Road to Recovery. We will then basically come back in no less than about 30 days and ask all of the subcommittees and all of the participants and those 120 different people, what do they think about these measures? Are they working? Are they not working? Do they need to be modified? Do they need to be changed? Do they need to be dropped? And so this obviously is going to be a very organic process as we go through it, and we need to be flexible and change with changing conditions as much as possible, as quickly as possible. So those of you who were appointed to the task force thought you were done. You're not. So we do appreciate all of the input we've had. It's been very, very valuable. And I think that it's important that we do things together and that we have the greatest opportunity for success if we continue to do things together. So with that, I don't think there's, this sounds like Chairman Valadez has a comment. Go ahead, Chairman.
Mr. Huckleberry, and just to address the question that was brought up by Fletcher in terms of we appear to be opening up. Fletcher, just so you know, we have actually had a lot of discussion on that, and whether we like it or not, there's a provision under Title 26 that basically says that we, as a county, the cities, and the towns have to follow along the executive order of the governor. So what we're trying to do and what we're discussing through a lot of this task force is how within the boundaries of that structure being able to move forward in the safest manner possible. But we don't have the ability to put on our heels and say, no, we're not going to do that. So I wanted to address that question because I know that was something that you had pointed out.
And I could add a little bit to that. The governor's orders on restaurants, if you read them, are many generic. They talk about physical distancing or social distancing. If you look at then our, quote, 17 points, they get very specific on general conditions that are in the governor's order. So with that, we do not think they're in conflict. And that's why we will probably go to the board and ask them to enforce them as legally enforceable under the emergency proclamation provisions that the current health crisis gives the board. Any other comments from anyone before we adjourn? David.
Hey, Chuck, it's Dave Hutchins. I had to go old school there. I'm not sure exactly how to raise my hand electronically on this WebEx. Can you hear me all right?
We got you. You're coming through loud and clear.
So I think probably the most important thing we can do, and this is what Laura talked about, is to have clarity in messaging, because I don't think any one of us could point all to the same exact list of criteria, et cetera, that we as a community should be following. There's a bunch of different websites. You might read something different in the paper than you might see on a website. But I think the most important, the absolutely most important thing is to have that clarity in messaging, because in the end of the day, you can say we can be safe, but we can only be safe if we do X, Y, and Z, if and only if we do X, Y, and Z. And we've got to have one place where we can all go and we can all go and see what that X, Y, and Z is for today. Because if we don't see that, then we have all these sort of side conversations. We have some people doing one thing, other people doing others. And that to me is a really big concern, because you can't get that commitment of a community if they're confused. So that's the only thing I want to throw out.
Thank you, David. Anyone else? Feel free.
Yeah, this is David Adami again from Chicano-Squacausa. Maybe talking a question to Dr. Robbins. Obviously, we operate charter high schools in the greater Tucson area, and many other schools don't have the resources that a university has and all the testing that you're going to be doing with your staff and anything. Is there plans to help the greater school systems within the region as they start to come back to school?
You want to unmute him, or is he muted?
He's muted. No, he's muted. He's muted. Yeah, he's unmuted.
Okay.
Can you hear me?
We got you.
Okay. So, David, I was saying that we've been very fortunate to work with Chuck and Dr. Garcia with the health department and Mayor Romero. We're trying to get the testing just for our community. It's very challenging, as you all well know. Number one, the antibody test, we pretty much got that down. We'll be able to do that for our 60,000 individuals, and the governor asked us to try to make it available to all the healthcare workers and first responders in the state. And we could not have done this without Chuck's help in the logistics of getting, because our test is a blood draw test. I think it's a different test to be able, as Fletcher was saying, it's not practical to do testing every day using antibody tests. Now, hopefully, there'll be point-of-care testing for an antibody soon that is reliable. I think the FDA commissioner said there's almost 140 of these point-of-care testing out there for antibodies and for viral testing. It's two different types of virus, two different types of tests. One, the viral, the molecular test is, are you infected right now at this minute you're tested? And the antibody would tell you, have you had the disease at some point? I was hopeful that the antibody test would show, more the New York numbers, 14% statewide, 20% in Manhattan. Of course, that's the epicenter in the world for number of cases, so that's going to be higher. Our data is just now starting to come out. It's going to be about 5%. You maybe, and maybe when the students come back, it could get as high as 10%. That's going to be important for sort of random testing that we would do. If one has an antibody, there's no need to test them for it because we don't think they're going to get reinfected. But it's such a low number, the practicality for policy decisions, I don't think it's going to be that important. It's going to help in terms of these spot testing and, more importantly, when the vaccine comes out. Because if you got antibodies, you know, decisions about who gets the vaccine first would be made based on the antibody testing. But it's complicated. The reliability, the accuracy, the validity of the test are really important. So it's a long-winded response to say we're struggling to do our own testing, and I know the state and the county are also struggling with us about getting tests available. The one thing that I am pretty confident about, we're going to be able to have the test kits, but it's an analysis of those kits. And we're looking into, you know, could saliva be used? Could there be a self-administered buccal smear in the oropharynx that could be used? So it's really complicated, and I don't think that we're going to have, as one entity, the ability to be able to service everybody. Because remember, we're running this out of a CLIA-approved research lab. We've got FDA authorization to move forward with this, but we can't run all the tests that we need to run every day just to cover our own needs. So it's going to be challenging, and that's why all of this, the basics of social distancing, wearing masks, washing the hands frequently, is going to continue to be important until there's a vaccine.
Thank you. Any other comments, questions from anybody? If not, I very much appreciate your taking your time and being with us, giving us your comments, your feedback. That's important. We will be doing this, obviously, again within 30 days if nothing else happens, but if something does come up, we will obviously ask everyone for their opinions and where we ought to be going. So thank you for today. Appreciate your efforts and your time. Thank you.